So with the governor's announcement yesterday to suspend all non-life sustaining efforts across the Commonwealth, what that means for the city of Lancaster is essentially all of our construction projects have been halted. This means that our construction of our new fire station, as well as the water line replacement efforts and other utility construction that's non-emergency will be suspended as of tomorrow. We are obviously going to be responding to any kind of emergencies related to water main breaks and so on. Our Department of Public Works is ready, and they have been working diligently to just make sure that the supplies that we need are in place, and also to work through the supply chains as we need them. Also, City Hall is now closed to the public, present company excluded. We will be continuing all of our essential operations as needed here from City Hall. Staff are mostly working remote when there are tasks that need to be completed to keep invoice processing, payroll, things like that. They are coming in to do that, but otherwise staff are home.
If somebody needs a service that City Hall would have provided outside of this shutdown, what can they do?
So our email and phone are always working. Phone system, we'll be checking voicemail messages, so call or send us an email. Obviously, all of our essential personnel, so if there's a problem related to your water, your sewer, police, fire, those numbers are available on our website, and the public still has access to all of that same information as before.
Can you tell me a little bit more about why this is a crisis that we've never seen before to this level?
Right. So one of the things that I was on a call yesterday with other mayors across the country, and the way that this was being described was a slow roll crisis, which was really helpful for me just to wrap my head around, because it's not like a car accident, it's not like a flood, it's not like a snowstorm where there's a beginning, a middle, and an end. This is, we're not sure, we are more in the beginning than the middle, and so how long this is going to last, I'm not clear. That is why City Hall and all non-essential functions here are closed until further notice. The other thing too, and this bears repeating, is just that this is new. This virus did not exist before. Everyone is susceptible, even young people, and that's something that I want to really impress upon the public to take this very, very seriously, because everyone can get COVID-19, the coronavirus. Not everyone will display symptoms, and this is why this concept of flattening the curve and why social distancing is so important. And I need people to stay home like it's your job, because that is our job right now, is to stay home. And I myself am largely working from home from this point forward, coming into City Hall on an as-needed basis, and really encouraging people to stay home, stay healthy, and to continue to adhere to all the protocols we've been talking about in terms of hand washing, social distancing, and making sure that you're only going out when you absolutely need to go out.
And can you explain to people that might not understand, what is Lancaster City government's role in helping with the surge of patients that we might see coming into the city?
Yeah, so our role is extraordinarily limited. Our core functions are 5. They are water, making sure that you have clean drinking water. They are wastewater. They are police and fire. And it is also related to trash and recycling pickup at the curb. Those 5 are our core functions that we are focused on. As it relates to the healthcare system here, I have been in contact with our healthcare system in Lancaster, and they are working and have been working collectively and individually to address this crisis for many, many weeks. And so they have been doing surge planning and marshaling all of their resources, human as well as equipment related, to prepare for a surge in volume of cases. When we reach the point, and I'm praying that we don't reach the point in which we are at capacity and exceeding our capacity, that is when we will need to rely on state and federal resources to establish other centers for care. There are lots of options for where those care systems can be provided, and we need to think about where it will be most efficient and effective from all kinds of things, like little detail things about how we can set up a system for care that is going to minimize the need for supplies that are disposable all the time, to thinking about just efficiencies in staffing and how to create a setup that is going to allow for maximum efficiencies because we don't have enough people. And our challenge again there is making sure that our healthcare workers are taken care of. And so this is another reason why, if you're concerned about the capacity here in Lancaster County and our healthcare workers, you will stay home. That is what everybody needs us to do right now.
And finally, what is your message to the people of Lancaster City and Lancaster County?
My message to them is to stay home, stay healthy, and stay strong. This is not going to last forever. There is hope at the end of this, but this is our one shot, and I am imploring everyone to practice social distancing. It is very, very important for us to get through this together and get through it as quickly and as safely as possible.